Hi, Dr. Rob here from the Ashgrove Spinal Centre. Today we're going to go through the Cervical Quick Scan, which is a quick scan that you can do at home just to check in with how your neck's moving and figure out whether or not maybe it just needs a little bit of an oily of the sticky hinges, and come in and see us at the Spinal Centre or whoever your chiropractor may be, just to get things moving a little bit better. Disclaimer at the start of this video though, if you have acute pain, if you have referred pain, if you have any of these things, this is probably not the right test. You would be much better advised to seek professional assistance. This is a quick scan for you to do when you're largely asymptomatic, to just check in and see whether things are moving well. The Cervical Quick Scan is composed of rotation. Most people should be able to get to about 60 to 80 degrees without any difficulty. A reminder, we're feeling for symmetrical movement. It should be an easy fluid movement. Should be the same on both sides. If you've got a difference between going to the left or the right or vice versa, that's something that I would flag and suggest you should probably consider coming in. Tightness, clicking, crunching, or it just not feeling good. The next movement is lateral flexion to the right and to the left. Much the same things that we're looking for here, but a reminder, movement in lateral flexion is generally more uncomfortable. Puts a lot more pressure on various structures like the oncovertebral joint, which we can talk about more in further videos. Rotation, which we just did earlier. The cervical facet joints, which is the bulk of the joints that facilitate movement in the cervical spine, they love rotating. The joints are oriented in that plane, they're shaped to facilitate that direction, so rotation should always be easier and more comfortable than lateral flexion. So just be mindful of that. The next one is flexion and extension, or looking up and looking down. So chin on your chest, and looking up at the ceiling. Chin on your chest, you may find tightness. It could be either down at the base of your shoulders, it could even be at the base of your skull. And looking up, you might well find you pinch things, which leads us into the next movement, which I call camps. It's a combined maneuver where we put our ear on our shoulder, we rotate to the same side, and then we look up. The reason this is such a good test is it puts a lot of load on the joints. And what it means is if they're not happy, they're going to let you know. So it may be a test that not everybody wants to do, because there is the potential for it to just stir up your neck where it wasn't a problem before, particularly if you have some degeneration in your cervical spine. But nonetheless, it is a good test just to really test your cervical spine. So that's the Cervical Quick Scan. Thanks very much for your attention. I'll keep this brief. We will refer back to this test in videos in the future. Otherwise, I look forward to seeing you soon.